Hello, my name's Joy.
I'm Chloe.
And I'm Janet.
And this is our diagnostics presentation, including labs, diagnostics, and imaging.
Okay, so first we are going to be talking about the complete blood count. This is also known as the CBC. This is going to include erythrocytes, hemoglobin, hematocrit, thrombocytes, and a white blood count. With the first three, there is a difference between the male and female lab values. Typically, the men will have slightly higher levels of all of these. For example, the erythrocytes for the males is going to be 4.7 to 6.1, while the females are only 4.2 to 5.4. When it comes to the hemoglobin, males are 14 to 18, and females are 12 to 16. Hematocrit, males is 42 to 52, and females are 37 to 47. With the thrombocytes and white blood counts, they are going to be the same no matter what. With thrombocytes, it is going to be 150 to 400, and white blood counts are going to be 5,000 to 10,000. With a complete blood count, it is going to be obtained from the venous blood. When it comes to the arterial blood gases, this is going to be the best indicator of oxygenation and perfusion status, and this is going to be obtained from an artery. All the labs we're going to have are going to be pH, PaCO2, PaHCO3, also known as bicarb, PaO2, and SpO2. For the pH, you're always going to want it to be in a range of 7.35 to 7.45. The PaCO2 is going to be 35 to 45. Bicarb is going to be 22 to 26. PaO2 is 80 to 100, and SpO2 is 95 to 100%.
Next, we're going to be having your basic metabolic panel, also known as BMP. And this is going to include both your BUN levels and your creatinine levels. Your BUN, you want it to be in a range from 7 to 20. Your creatinine, 0.6 to 1.3. And this includes your glucose levels, your sodium, your calcium, potassium, magnesium, chloride, and your CO2. And this is going to be obtained from a vein, because we want it to be your venous blood, not arterial blood. We also have our comprehensive metabolic panel, which is also known as your CMP. And this is going to include everything in the basic metabolic panel, in addition to your total protein, your albumin, total bilirubin, your ALT, and your AST.
Now to cover renal function. So in your renal function, you're going to have your blood urea nitrogen, also known as your BUN, and it's going to be, normal range is going to be 10 to 20. Your serum creatinine is different for male and female. Your female will be 0.5 to 1.1, and a male will be 0.6 to 1.3. For glomerular filtration, it should be over 60 seconds. If it's any lower than that, that can mean you have some type of kidney injury. And for liver function, it's going to include your albumin, which should be 3.5 to 5, your bilirubin, which should be 0.3 to 1. Your globulin creates antibodies, enzymes, and it transports your blood. This will also include your ALT, your AST, and your alkaline phosphates.
All right, next we have the cardiac labs. This is going to greatly show if there was a case of an MI or any other cardiac episode. For example, troponin is one of the greatest indicators of a MI in the past. The greater the number, the more recent the event was. So on average with troponin, you're going to want it to be less than 0.1. Any greater shows that something else is going on. Same for the creatine creatinase. You're going to want it to be from 0 to 3%. Any greater than that shows some sort of heart condition, including heart failure or an MI. Similar with myoglobulin, you're going to want it to be less than 90. And then the brain neuratic peptide, less than 100. And the C-reactive protein, less than 0.3. When it comes to the coagulation labs, you're going to have your average platelets being between 15,000 and 400,000, with your thrombotin time, also known as PT, being from 11 to 12.5 seconds. This is considering you not being on an anticoagulant. If you are, it's going to be a little longer. And you'll see that in the International Normalized Ratio, also known as an INR. This is going to be 0.8 to 1.1 if you're not on an anticoagulant, but if you are, it's going to be 2 to 3. Then you also have the activated partial thromboprotein, and that's going to be 30 to 40 seconds, and the fibrinogen 200 to 400.
Now we're going to be getting into our diagnostic testing. So for the first one, this is going to include your urine test. So this is going to be related to your kidneys to see if we have good function of the kidneys, to make sure you're urinating properly and that you don't have any retention. So you can test for your ketones, HCG, drugs, and pregnancy, all with urine testing. And a couple different testing forms that we have are going to be your urinalysis, your 24-hour urine collection, and your culture and sensitivity testing.
And for stool, it's going to be related to your GI tract, and you're going to use a Bristol stool chart. And some things you can test for are your occult blood, ova, parasites, and C. diff.
Next, we're going to have biopsy and aspirations. You have a paracentesis, which is draining fluid from the peritoneal cavity. And then similar to that is the thoracentesis, which is when you drain fluid from the thoracic cavity. Additionally, we have biopsies, which is a tissue sample. A lot of people will associate this with testing for tumors and other abnormal tissues that could possibly be cancerous. We also have a lumbar puncture and a bone marrow aspiration, which is also commonly linked to testing for cancer.
Another diagnostic testing that we have are swabs. So this is what we commonly see anytime we go to a checkup and we're feeling a little sick. So the first one is going to be your sputum swab, so to see if we have any mucus in the lungs, and we're going to put that in a sterile container to test for pneumonia or TB. We also have our throat swab and our nasopharyngeal swabs to test for COVID, RSV, and flu. And then we also have our wound drainage swabs where we can see if our wound is getting infected or if it's getting better.
And now we're going to do our imaging.
So for the first imaging, we're going to talk about radiography, which tests for your bones, organs, and tissues. So we have two different kind of radiographies, one being non-contrast, and the other one where we do use contrast dye in this testing. So for our non-contrast radiography, we're going to be having a couple different x-rays. So this can be to see your skeletal system, your chest x-ray, to see if we have proper placement of tubes, to see if we have any pneumonia. We also have our abdomen x-ray and our soft tissue evaluation. And you can see here in this picture, this is a good example of our x-rays. And then we also have our screening mammograms. So with a mammogram, this is where we can see early breast cancer detection. It's pretty common to see women go and get these regular mammograms to make sure that there's no breast cancer detection. And then we also have our diagnostic mammogram to detect for any lumps, any pain, or any abnormalities that we may have. And then with our contrast radiography, we have our gastrointestinal studies, which is going to be excuse me not being able to pronounce this word, but it's the esophageal. Sorry. And then your GI studies, which is going to be your intravenous pyelogram.
Okay, next we're going to talk about a CT or CAT scan. This is going to show abnormal tissues, organs, fluid, air pockets, and skeleton. A CT scan, as you can see right here, it is going to take a bunch of pictures of your body, and then you are going to be able to splice each of those individual pictures to see abnormalities within the body. It is commonly a large procedure and scan where you will slide into a huge computer and stay there for an extended amount of time while they take all of these pictures. And in many cases, you are also going to use a special dye called contrast. And this is going to be used to be able to differentiate different tissues or air pockets, organs in the body to make it easier for the people afterwards to assess and read. And then additionally, you will need to test or double check any allergies like shellfish or iodine, because this is commonly in contrast, and if somebody has a bad reaction during a CT scan, we just want to try to avoid that at all costs. So you will need to check for allergies beforehand. And then also we're going to talk about an MRI. And an MRI is a detailed image of the body's internal structures. So you can see it on this bottom picture right here. It is commonly used throughout the entire body, but in this picture I thought it was really cool because you can see just how detailed they can get an image of the brain in this case. Like you can see each individual area. So this is going to be a very high strength magnet that we use, and so if you have any internal metal, whether that be screws or plates or even any piercings, hearing devices, anything like that, if you can remove it, then you are able to go ahead and do an MRI. If it is an internal metal of some sort, then unfortunately you are not going to be able to do an MRI because it would be able, the magnet is so strong it could rip it out of your body, and that would obviously be like a horrible scenario. So you have to definitely make sure the person is clear of any metal. And additionally, the room. If you are doing an MRI, it will suck any metal within the room into the device. You can look up some crazy pictures of that. And so we definitely want to make sure that there's just no chance of that happening. And so this is going to have a lot of nursing considerations before you can do this MRI.
Okay, so we're going to do ultrasounds, and they're used to check on babies for mamas who want to see their babies, and then they're also used to check on people's kidneys and their livers. Now, an echocardiogram is a specific type of ultrasound that focuses solely on the heart. The process of a ultrasound is they place a wand over whichever part of the body they want to get a look at, and then sound waves are transmitted into the body, and then an image is shown on the screen, such as this one right here. That's a 3D ultrasound. And then we also have PET scans, which is positron emission tomography, which is usually used to screen for cancer. The way this one works is a small amount of radiation is going to be given in the form of glucose, and then it's going to be administered into a vein. The radiation glucose actually accumulates into the malignant cells, your cancer cells, which then is shown up on a PET scan, which is what this one right here is. I thought that one was really cool. Okay, and this is where we got all of our information. These two lovely ladies, thank you so much.